Okay, picture it.
I'm picturing.
A gang of cells in the immune system called the B cells are going around wreaking havoc, causing all kinds of unnecessary inflammation, destroying small nerve fibers, beating up bone joints and vital organs, and causing the muscles to become weak and painful. Basically, it's damaging the body's healthy tissue.
This is bad.
Well, the thing about this B cell gang is they do have a weak spot on their surface called CD20 protein, and this makes them vulnerable, but unless you know exactly where it is, they're very difficult to stop.
Oh no.
Many have tried, the steroid police, undercover NSAIDs led by Captain Advil, and his sidekick, acetaminophen, but they only succeeded in slowing them down a little bit, not stopping them.
Okay, I'm very concerned.
Yeah, rightfully so. So what do? Well, we give Rituximab. Okay, in case you missed it, we're talking all things Rituximab today, which is a powerful drug that entered the market in 1997 and is manufactured by Genentech. Main uses are adults with non-Hodgkin's lymphoma and children 6 months of age or older with B-cell non-Hodgkin's lymphoma and B-cell mediated leukemia. Autoimmune conditions treated with Rituxan include vasculitis, rheumatoid arthritis, lupus, and inflammatory muscle conditions like polymyositis, and some off-label uses including neurological diseases such as myasthenia gravis and neuromyelitis optica, and small fiber neuropathy secondary to Sjogren's syndrome. Basically, Rituxan is effective in treating B-cell driven inflammation.
Can you spell all those, please? What type of drug is Rituximab?
Rituximab.
Right, I'm gonna need to look this up in Mosby's drug guide.
Alright, well, Rituximab is a class of drug that we refer to as a biologic, and this simply means it's made from living cells such as microorganisms, plant cells, or animal cells. And when we give someone this drug, they're receiving a specific type of therapy called B-cell therapy, which also falls into the category of immunotherapy, or it's also called antibody therapy.
Oh, so this is where the B cells come in.
Rituxan is a man-made antibody that was developed to target a specific protein called CD20, which is found on the surface of white blood cells called B lymphocytes, or B cells. It searches for, attaches to, and marks the CD20 protein found on the surface of cancer cells and some healthy blood cells as well. Once attached, it's thought to work in a few different ways, including triggering the immune system to pick out those cells marked for death and finish the job.
Dun dun dun! It's kind of like the Nephilim searching for Malthael in Diablo 3 Reaper of the Souls.
Sure. Okay. So it destroys both abnormal and some normal B cells, but once treatment is over, the body can replace the normal B cells.
Okay, so how's Rituximab given?
First doses of Rituximab have to be given as an infusion in a monitored setting, meaning they have to be done in an outpatient infusion suite or a hospital due to the potential for serious allergic reactions. Usually, you'll start treatment with 2 infusions given 2 weeks apart, and then they'll be repeated when it's starting to wear off or to prevent a flare-up of your condition. This can be anything from 6 months to a few years later, but will never be repeated unless at least 4 months has passed since the last dose. The first infusion usually takes around 6 hours, and later infusions may only take about 4 hours, but it really just varies and depends based on how you respond to the infusion and the drug. Many people need to have infusions at least once a year. Or if you have vasculitis specifically, your treatment may be more frequent than this. On the day of your infusion, you may be given steroids, acetaminophen, and an antihistamine like Benadryl, which helps ease the symptoms of allergic reactions.
Okay, anything else about Rituximab I need to know for patient education?
I thought you were looking this up in your Mosby's.
I am, but you're such a fountain of knowledge, I figured why bother?
Okay, well, yes, side effects. Side effects are very important to talk about. Most common ones include headache, night sweats, fever, vomiting, depressed mood, constipation, cough, feeling hot or flushed, shivering, dizzy, and a few people may feel just generally unwell or experience wheezing, a rash, or a fall in blood pressure while they're having the infusion or right after it.
I feel like you're missing a few things.
Give me a chance. Rituximab affects your immune system, which can make you more likely to pick up infections. Tell your doctor or nurse straight away if you develop any signs of infection, which can include a sore throat, a fever, or any other new symptoms that concern you. You should also see your doctor if you develop chickenpox or shingles or come into contact with someone who's developed these illnesses recently, as they can be more severe if you're taking rituximab due to the immunosuppression. You may need to get treatment, and your infusions of Rituxan may be stopped until you're better.
Still forgetting something.
Rituxan does have a few very serious potential effects.
I knew it. Lay it on me, Nurse Ratchet.
It can also reduce the number of platelets in your blood, also known as a condition called thrombocytopenia.
How do you spell that?
Gretchen, I'm trying to I'll spell everything for you later. Platelets are, of course, responsible for blood clotting, so tell your doctor if you have any unexplained bruising or bleeding, which can include nosebleeds, bleeding gums, or tiny red or purple spots on the skin that may look like a rash, and these are called purpura. Some people may even need a platelet transfusion at some point. And one of the most serious issues is something called progressive multifocal leukoencephalopathy. Hold up. So this is a rare and serious brain infection caused by a virus that can happen in people who receive Rituxan or have a weakened immune system. This can result in death or severe disability, and there is no known treatment, prevention, or cure for it. So again, tell your doctor or nurse if you have new or worsening symptoms, or if anyone close to you notices the following: confusion, dizziness, loss of balance or difficulty walking or talking, decreased strength or weakness on one side of your body, and vision problems.
What about vaccines with Rituxan-bippity-boppity-boo?
Yeah, if you've had recent vaccinations or you're scheduled for any, you shouldn't receive certain ones before or during treatment.
According to Mosby's, Rituxalax may pass into your breast milk, so do not breastfeed during treatment or for 6 months after your last dose of Rituxan-dippity-doo.
It's rituximab. And it's correct. Also, Rituxan may cause chest pain, irregular heartbeats, and heart attack. So your healthcare provider may monitor your heart during and after treatment. Kidney problems are also a serious potential issue, especially if you're receiving Rituxan for non-hodgkin's lymphoma. It can cause severe kidney problems that lead to death. And you should have blood tests to check how well your kidneys are working prior to starting therapy. Last are stomach and serious bowel problems that round out this list, and these include blockage or tears in the bowel. So any abdominal pain or repeated vomiting during treatment should be reported immediately. Now, Rituxan is only one of several treatments for the conditions mentioned, but IVIG and plasmapheresis can also help, which I go over in detail here.
I'm watching them right now because I have no clue what they are. What plasma? How do you spell that?
Thanks for hanging out with us today. I'm Danielle, and this is student nurse Gretchen, and this has been Lucid Med. If you had fun or learned a few things, like, comment, subscribe, or share. All interaction helps. And like most topics we cover, this one today was requested by you. So if you'd like to request a video, go to danielle@lucidmed.com or message me in the comments. I read every single one of them, and I'm happy to get them. And I think I've done a good job at responding to pretty much all of them to date. I think I have.
I think you have too.
Yeah. If you'd like to support the channel, consider becoming a member on our Patreon. You could support with as little as $3 a month or grab something from our store.
Our t-shirts are guaranteed to make you smarter and healthier.
Really?
I don't know.
That's all for now. Until next time, stay healthy and lucid and know that you are so valued and truly appreciated.